Good afternoon, everybody. Thank you so much for joining the NYU Child Study Center's webinar series. I'm Dr. Yamalis Diaz. I'm one of the psychologists here at the center who specializes in child behavior problems and ADHD. And today I'm going to be talking to you about taming your Tots tantrums, which I'm sure is a topic that many of you logged on because you might be experiencing some on yourself. Before I begin, let me just say that you can submit your questions at any time by typing them into the questions pane of the control panel, and that's the one on the right side of your screen, and we will answer questions at the end of the presentation. Okay, so let me just start by setting a little bit of an outline. I will say that I love this topic because this is what I do for a living, so I could go on and on, but I'm going to try to keep it really focused on managing the tantrums. So we're going to start by talking a little bit about tantrums and emotion regulation skills, managing the tantrums, and teaching emotion regulation skills as you're doing that, a summary of do's and don'ts, and your questions. Okay? So the first question I guess we should answer is, what is a tantrum? There are many different terms that people throw around, and there's no sort of one term that anybody can land on. Sometimes people call them outbursts, meltdowns, freakouts, but a tantrum is sort of often misunderstood as just being defiance or some form of attention-seeking behavior. And while it may be the case that the child is in fact engaging in some defiant behavior or is trying to seek a parent's attention when they're having a tantrum, that's not really the core of it. So a tantrum, just as sort of a basic definition, is a behavioral manifestation, meaning what the child is doing, a behavioral manifestation of very strong emotions that are overwhelming that child's coping skills, otherwise known as their emotion regulation skills. And that's what we're going to be talking about today. And of course, the tantrum, depending on your child's age, can range from just crying and whimpering and kind of carrying on a little bit on the floor to full-blown aggression, destruction of property, and really having quite the outburst. The other thing to know about tantrums is that they can be triggered by minor to very major challenges. And I often tell parents it's really not up to us to decide whether or not your child should be experiencing that emotion in the first place. If they're having that feeling, they're having that feeling. And so we don't get to agree or disagree with the fact that the trigger was minor and they shouldn't be experiencing a tantrum. We only have to focus on how to get them to cope with that a little more effectively. One thing I do just want to mention is that although I am going to be using a lot of examples and talking about tantrums from sort of a behavioral perspective in terms of a full outburst, anxiety is actually an often overlooked trigger for tantrums. Oftentimes, we don't realize that one of the reasons kids are sort of having a tantrum is because something about the situation is making them anxious. And we don't want to overlook that. So I will do my best to sort of incorporate that as I'm talking, but just keep that in mind in case this is true about your child. So what are emotion regulation skills? And I apologize, I meant to do these one at a time, so I'm sorry if the screen just overwhelmed you. The first thing to know is that emotion regulation skills really are about the ability to identify as a first step, process and manage as a second step, and then appropriately express emotions. That's what basic emotion regulation skills are. We all have them. As adults, we hope we've gotten further than the kids, but sometimes that's not the case. But this is really the core. You're hoping that they will learn how to recognize what they're feeling, do something about it, and then move on with life, right? Research has actually linked poor emotion regulation skills to many psychological, social, and academic concerns. They really are a core component of your child's development. So it's very important to focus on helping your child develop these important skills. What's important for you to know today is that kids learn these skills through a variety of experiences. Sometimes I hear parents sort of just expect that kids will learn these skills as they go. So they might say things like, stop crying, knock it off, calm down. And when I hear parents use those kinds of phrases, what I can see is that the parent expects that the child knows how to do that. And the fact is that kids, because they learn these skills through experiences, those skills need to be learned. Okay? One of the major predictors of the way that kids will learn emotion regulation skills is the way in which adults respond to their little tantrum or meltdown. And unfortunately, adults will often find themselves responding to the behavior that they see versus the emotion that the child is experiencing. And this is where we miss an opportunity, not only to reduce the behavior that's happening in the moment, but to manage or to teach those skills over time. So let me emphasize that point again. Focusing on what the child is doing, the crying, the carrying on, the screaming, the tantruming, that's one piece. But if that's all you're focused on, you're going to miss the emotion regulation skills underneath. And that's really what we need to teach the child, not just stop crying, but how to stop crying. Okay? So common reactions to child tantrums, I'm sure you guys could probably list a number of them, but I think it's important to highlight that reactions from adults, parents, teachers, other caregivers can really vary based on the situation and the intensity of the tantrum. What happens here is this creates a lot of inconsistency, and it makes it hard for the child to start learning those necessary skills. I just mentioned that kids learn these skills through experiences, and what they need is kind of a collection of experiences, similar, consistent experiences, to start recognizing when to use which skills. So this inconsistency can sometimes make it hard for them to understand what they should be doing differently. So typically when parents respond to a tantrum, they are focusing on either helping the child calm down, or they're trying to confront or punish the behavior that they see. Usually it's not both at the same time, but it can be. And so what I mean by this, some common reactions, they may range from reassurance, validation, rationalizing, talking, explaining, coddling, holding, soothing. These sound like some of you parents, I'm sure, and sometimes withdrawing the demand or just giving in, right? And that's sort of focused on just helping the child calm down. Let's just get this over with. And then there are parents who might yell or argue, threaten punishments, actually implement punishments, or use a combination of all of these things. And those might be focused more on confronting the behaviors. So what I want you to really keep in mind, now that we have a little bit of a backdrop about tantrums, is what is it that we do instead? I've told you what the common reactions are, and I've told you that the kids need to learn these skills. So what exactly is it that we're trying to teach? Let me give you, and you will see this throughout, because I hope to share a consistent set of steps that you can use as you respond to your child's tantrums. The first one being that we're trying to teach the child how to recognize that they're having a feeling in the first place, what we call emotion identification. You really can't do something about an emotion that you're experiencing if you don't know you're having it. Think about this in adult terms. If you don't know that you're feeling anxious, that you're feeling distressed, that you're feeling angry, frustrated, you might wait a while before you do something to help yourself calm down. The same thing happens for kids, and often they go from 0 to 60 very quickly because they didn't recognize that it was sort of coming on in the first place. So step one to good emotion regulation skills is emotion identification. Step two, once you've recognized that you're having a feeling, is to actually pull up those emotion regulation skills and manage the emotions more effectively. And there are a gazillion different coping and emotion regulation skills that kids can use. And then the third is, once you've recognized that you're having a feeling and you do something to effectively manage it, you either problem solve the situation or move on. Right? I often tell parents, and really adults as well, that almost every situation you can think of really boils down to two possible outcomes. There's either something you can do about it, and so you should problem solve, or there's nothing you can do about it, and so you should accept and cope. And that's for you guys as well, the adults. So what we're trying to teach the kids is recognize what you're feeling, do something about it, and either problem solve or move on. So how do you go about doing that in the midst of a tantrum? This is a lovely little graph of, it's just a hill right now, but let me give you some very concrete steps that you can use when your child is having a tantrum. And I want you to recognize that we are focusing on two very important goals: reducing this tantrum right here, right now, in this moment, and also teaching and coaching emotion regulation skills over time. So the first phase of a tantrum is the child has been triggered, something has upset them, and again, it does not matter what upset them or whether it was minor or whether you disagree with the fact that they're upset, but something happened and they are triggered. This could be homework, bedtime, they dropped something, they broke something, their friend doesn't want to play with them, somebody borrowed a toy, it could be anything. And so they go into agitation mode. That is phase one of a tantrum. During this phase, parents will often try a number of things to get the child to calm down very quickly. What I want you to do, instead of the variety of ways that you might be responding, is to focus first on labeling and validating the emotion. Remember that I mentioned that the very first step to good emotion regulation skills is recognizing that you're having an emotion, so emotion identification. So in this moment, if you can say to your child, I can see that you're feeling frustrated, disappointed, angry, upset, anxious, nervous, and use a very wide range of emotion words, they will start to build their vocabulary for recognizing what they're feeling. They will also be able to recognize what the kind of physical sensations of all of those emotions are. And so by labeling it and validating it, not only will you point that out, but you'll let them know that you understand that in this moment, they are experiencing this feeling. In this phase, you can also suggest a coping skill or a solution to the concern, right? So if they're frustrated, for example, that something happened at school and they're starting to melt down, and you say, well, I understand that you're really frustrated about what happened at school. Maybe what you should do is X, talk to the teacher tomorrow, talk to your friend, whatever it is you suggest. And your child doesn't want to hear that. You've already done your part in phase one. Let me also give you an example for younger kids. We know that young kids tend to have tantrums and meltdowns around very small things like having to give up the iPad, having to turn off the TV, having to sit at the table, putting something away, not playing anymore, leaving the playground. Those are all situations where little guys might have a tantrum. And so as soon as they start to melt down, you can simply say in a very neutral tone, I understand that you're frustrated that we have to put the iPad away, and the sentence will continue, but, and you're going to give one suggestion of what they can do next. Now, assuming that this doesn't work, and by the way, I'm fully aware that it probably won't, just immediately shut down the tantrum, but that's why there are 3 phases and 3 steps. So your child continues up the hill, and they are going into full agitation mode, and then they reach peak. At this point, you can see that your child is at the peak of their dysregulation, and for your child, that may be crying and whining. For another child, that may be aggression and destruction of property, throwing things, ripping things, etc. At this juncture, you are not going to join them up on the hill. Your responsibility is to meet them at the bottom of the hill on the other side. So they're going up and you're going across. So you're going to move on to step 2. At step 2, you are going to suggest a skill, a solution, and or you're going to clarify your expectations. So let me spend a minute and talk about what I mean here. Oftentimes parents will say that they try to talk to the child, they try to rationalize with the child, they try to tell the child this is enough, they punish, they threaten, they may do any number of things. This is the time when what you really should be doing is trying to suggest a coping skill, make your expectations clear, and then move away from the child and disengage. And I'll show you that in step 3. So what I mean here, you might say to the child at step 1, I'm really sorry that you're frustrated that we have to leave the playground. I'm really sorry that you're feeling so frustrated that it's time to turn the TV off, but it's time to leave. Right? Please follow me out. I get that you're frustrated. Take a few deep breaths and follow me to the car. Right? So what you're doing here is you're suggesting a coping skill, validating the child's emotion, and you're making your expectations clear. The reason that I think it's so important to clarify your expectations here is because sometimes parents will overshoot the mark here. And what I mean by that is that because they're so intent on bringing the child's behavior under control, they may use increasingly assertive methods, and they might actually start yelling and shouting or arguing with the child. What you want to do instead is make it clear that you are asserting your parental authority without shouting and yelling. So this is why I say that you should clarify your expectations using a slightly assertive tone without raising your voice. Okay? Assuming that your child is going to be up at peak for a while, you're now moving on to step 3. So between peak and phase 3, which is recovery, your responsibility is really to disengage at this point. Your child is melting down, they're having a tantrum, they're crying, they're carrying on. You've already tried, before we've gotten to step 3, labeling and validating, maybe suggesting a coping skill or 2 at phase 1, and then you moved on to phase 2 and you suggested another coping skill or 2 and gave them a couple things that they could do, and you made it very clear what needs to happen next, and they're still carrying on. At this point, it is your responsibility to transfer responsibility to your child's brain and body to help them calm down. Think back to when we talked about babies learning self-soothing skills. You really need to give your child an opportunity to kind of build that muscle. So between step 2 and step 3, your goal is to disengage. At step 3, which is an often missed step, where parents will see that the meltdown is over, the tantrum has finished, and oftentimes will either completely disengage, pretend it never happened, or will go straight into frustrated or discipline mode. What I want you to do at step 3 instead is use what I call the love sandwich. A love sandwich is essentially a statement, a positive statement with some constructive feedback in between, followed by another positive statement. The reason this is so important is because this replaces what parents often do at the peak stage when it's just not going to work. Your child at peak is neurologically dysregulated and they cannot process some of what you're saying. So their logical thinking, their reasoning, their rational thinking is all sort of tanking in this moment. And you're trying to explain or talk or discuss or threaten or punish. They can't hear any of that and they cannot process that. So what we're doing is we're taking the information that parents often want to offer the child at peak and we're moving it to once the child is calm. This is where you can do some of your best coaching and where you can really engage the child in learning how to recognize what they were feeling, why they got so upset, and what they could do next time. Okay, so just to reiterate, and then I'll move on to talking a little bit about what you can do in the love sandwich. You're labeling and validating. Your child continues up the emotional hill. You're moving on to a clear, neutral suggestion of a coping skill, and or you're clarifying your expectations, and then you're waiting for them to calm down, and you will meet them after the recovery phase when you can return your attention and provide them with a nice love sandwich to munch on. So I'll give you a clear example. Honey, I can see that you're frustrated that your teacher gave you so much homework today. Maybe what you can do is take a little break, get your body under control, and then come back to the table. I expect you to be back at the table in 5 minutes. Your child is having a meltdown. You disengage. When they finally return to the table and sit down calmly, thank you so much for sitting down calmly, and then you're going to go into the love sandwich. For the little guys, it might be, I can see that you're really frustrated that I said you couldn't have more ice cream. This would be a really good time to go sit on the couch and take a few minutes to calm yourself down. I think this would be a really good time to go to the couch and take a few minutes to calm yourself down. They're still going. You have 2 choices. You can either sit on the couch and take a few minutes to calm yourself down, or you can go to your room and take a break, whatever the 2 choices might be. But the expectation is clear. And then you're waiting for them to calm down, and then you're re-engaging with the love sandwich. And this is what you put in the love sandwich. First, you're going to praise. This is a missed opportunity oftentimes for parents and teachers after a child has had a tantrum. Almost always when I observe, what happens first is a comment about the negative behavior. What I want you to do instead is focus on the fact that your child is now calm. They must have used some pretty good coping skills. They did something well enough that they managed to calm themselves down. So when they return and they are calm, start by making a statement about that behavior. So praise the positive behavior, focusing on the use of coping skills. Thank you so much for calming down. I can see that you're calm now. Thank you for coming back. I really like how you lowered your voice. Thank you for coming back to talk to me calmly. Now, at this point, this is where you're doing your feedback and your coaching. Here, you're going to provide the child with any constructive or important information that you think they need to understand about the situation at hand. And you're going to keep your tone neutral. So be very careful that if you're still feeling frustrated, you might actually say to your child, you did a really nice job calming down. Mom and Dad, still a little bit upset. We'll talk in a few minutes. But if you're calm, then you can provide this constructive feedback. This is where you include any discussion, all of those explanations, the rationale that you might have found yourself wanting to give them when they were tantruming, any discipline that has to happen, any negative consequences happens here. And I know what some of you are thinking, oh gosh, would I do a negative consequence here and then set them back off? The answer is unfortunately yes, right? We're not worrying about whether or not we're going to set them back off. But if, in fact, they engaged in any aggressive or destructive behavior during the tantrum, a negative consequence is probably appropriate. But that's up to you and up to you to decide how you're going to respond to your child. Nevertheless, you start with the positive, and then you provide any additional information that's constructive in between, and then you layer on another slice of love. So you finish that conversation with more positive information. You did a really nice job calming yourself down. you got really upset about that, and the last time this happened, we talked about X, Y, and Z. So when you were walking past me, you hit Dad, right? And you know that hitting is not acceptable, so you lost 10 minutes of your iPad time later on today, okay? But I'm really proud of you for calming yourself down. That's just an example of a love sandwich. So I just want to point out, and having walked through all three of those steps, that those steps coincide with the skills that I mentioned that your child needs to learn. You labeled and validated their emotion, they felt heard, and you helped them understand what emotion they were having. You suggested some emotion regulation skills that they might have gone and used when they were calming themselves down. And then you help them move on and/or problem solve the situation, right? Importantly, you might also decide that you're going to create a coping plan with your child in advance that includes those same three steps. These pictures are probably starting to get boring, but you might actually say to your child, when I feel X, Y, Z, help them identify those emotions, I can use one of my coping skills, and then I can move on or problem solve when I'm calm. So the coping plan layers onto those three steps as well. And last but not least, you can create your own coping plan. We know that parents feel stressed and frustrated, and I get it. But you want to make sure that you're addressing some of these parenting challenges as calmly as possible. So when you feel frustrated, mad, irritated, aggravated, you can use one of your coping skills, meditation in this case, and then move on or problem solve when you're calm. So this is just a summary of do's and don'ts that will be included in the presentation. As I mentioned, during agitation, do use a natural tone and label or validate. Don't withdraw the demand or give in. During peak, you're trying really hard to avoid talking as much as you can, and you're only suggesting one or two coping skills, and you're really being mindful not to threaten or punish in this moment. And after recovery, you're praising the positive behavior. Thank you so much, and I just want to mention that I just started a monthly blog on Psychology Today entitled Parenting Challenges 101, so you can take a look at that for some additional parenting tips. And now I'll take some questions. Okay, question number one, when labeling emotions for a 4-year-old, does one mention many different emotions or just one? In any one situation, label just the one. But as you're really using this particular model, try to use as many emotion terms as possible. For a 4-year-old, you might have a sort of group of maybe 6 to 8 emotion terms. For a 6 to 7-year-old, you might really increase that to 10 to 12 emotion terms. You just want to give them a really good library of emotional terms. Okay, next question. My 8.5-year-old son often has tantrums. Is it normal? Please share some strategies to manage tantrums for an older child. Well, one thing I will mention is that really for kids of any age, if your child's tantrums are very intense, they happen frequently enough, from daily to even a couple of times a week, and they're starting to really create some stress and frustration either at school or at home, I would encourage you to see a behavioral therapist that might be able to help you determine what is the cause and the nature of your child's tantrums and what additional strategies you might use. So the answer to the question, is it normal? For an 8.5-year-old, we wouldn't expect to see tantrums. It's not one of their go-to strategies, but if we are seeing tantrums in an 8.5-year-old, we know that already their emotion regulation skills are a little bit behind what we would expect. Tantrums are pretty typical for children up to age about 4 or 5, even 6, and then we're starting to look to see that they have better skills on board. Would you suggest the 4-year-old play with an 11-year-old or plan with an 11-year-old? Sure. I think that 4-year-olds and 11-year-olds or little guys and older siblings can certainly collaborate on either playing together and or developing some little coping skills together. And certainly older siblings can sort of be brought on board to be good models for their little guys, for their little siblings as well. Any other questions? We're just waiting for your questions to come in. Keep them coming, and we think we have another few minutes. And I'm happy to review anything that I covered today while we were talking. One thing I will say that you might be wondering about is just a lot of parents will sometimes ask me what they should do if they are in fact feeling angry or frustrated with their child after a tantrum, I do think this is an opportunity to model for your child what it looks like to label your emotion and say what you're feeling. So you might actually say, honey, mom or dad is actually still really frustrated. I need a few minutes to myself, and we can talk about this when I'm calm. Okay. Another question, my 2-year-old son is in the tantrum stage. He throws himself on the floor or hits me. What would you recommend I do? This is a perfect opportunity. Now, a 2-year-old is a really little guy, so they really lack the verbal skills to express their frustration. This is probably what your son is having the most trouble with. And so what you really want to focus on is that first stage, right, where you're labeling it. Honey, I can see that you're really frustrated. I'm going to give you a minute to calm yourself down, and then you can tell mommy what's going on. I can see that you're really upset. Let daddy know when you're ready to talk. The goal here is to do a little bit and then disengage. I cannot overemphasize how important it is to really step away from the tantrum while it's happening so that your child has an opportunity to actually focus on regulating themselves. One thing I do, I'm going to just go back to the slide here that included the summary so that you can see some of those additional points I wanted to make. Another question we have is, my son is very strong-willed and doesn't negotiate until we give in to the demands. How do we turn the tide on his demands? This is a really good one, because certainly what will happen over time is that your child will really start to understand that the only way to get what they want is to really go for it. And so the more he ups the ante, the more he gets out of you. Once a child has sort of gotten to a point where they're using really strong-willed behavior, aggressive, destructive, insistent behavior where parents find themselves giving in quite a bit, I often recommend working with a behavioral therapist to really make sure that you're using effective strategies to bring some of these behaviors under control. One thing that I just want to highlight is that oftentimes parents will use some really great parenting techniques that might just not match with their particular child's temperament. So although they may be perfectly appropriate parenting strategies to use in some situations, if they're not working for your child and your child's tantrums or outbursts are not actually decreasing, that's a sign that those strategies are just not matching for your child. It's again another sign that you might want to work with a behavioral therapist if your child's tantrums are now outside what we would consider the average range. And the last question is, while disengaging, will the child feel abandoned if I leave the immediate area, or stay by and wait until they calm down and don't feel abandoned? Great question. I'm so glad somebody asked this one. The goal is not to leave your child in a punitive way, right? So you're not saying things like, I'm not talking to you, leave me alone. We would never want the child to feel that because they're having a negative emotion, you're not going to help. What you're doing is you're communicating to the child, when you're calm, we can talk. And you can say that once or twice. The goal really is, though, to let them do it on their own. So between 2 and 3, if you find that the child needs your support, you can say, I will talk to you just as soon as you're calm. I'll be right here, and when you're calm, we can talk. The child might keep trying. As soon as you're calm, we can talk. I'll be right here. So you don't have to leave, depending on the amount of the behavior that the child is displaying. You don't have to necessarily leave. You just need to disengage and give them the opportunity to come back down that hill on their own, where you will then re-engage. Okay, and that was our last question. So I just wanted to thank you all for joining the webinar today. I hope that you found that useful. On behalf of the Child Study Center, thank you for joining. And once you leave the webinar, you will receive a survey, and we would appreciate if you would complete it. You will also receive a follow-up email within a day or two with a link to a recording of today's presentation. We hope you can also join us for our next webinar, Facing Your Fears, with Sarah Kern, and that's Tuesday, January 10th at 1 p.m. Thanks again. Happy holidays, everybody, and we'll see you in the new year.